Good evening. Welcome to our City Council meeting of Monday, August 2nd, 2021. Appreciate everyone being here this evening. We're going to start it off with our invocation and pledge by Councilmember Duckworth.
All right, thank you. Dear Lord, we thank you for the opportunity to gather here today and for all those who have come before us to give us the opportunity and freedoms to do so. Dear Lord, as we have conversations tonight and learn about our pandemic, we ask that you grant people wisdom, patience, and compassion. Dear Lord, we're reaching the time of year when the students move back into town, so ask for an extra dose of that patience as they find their way around and we all work together. Dear Lord, we're going to be discussing business of the city and just ask your guidance upon all we do. Thank you for many blessings. In your son's name we pray. Amen. Amen. Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you very much. We appreciate that, John. And I'm going to turn it over. Before we turn it over to public session, I just wanted to thank Councilmember Smith for filling in for me a few weeks ago, 2.5 weeks ago, while I was away, or 3 weeks ago. So thank you very much. Appreciate it. And I will turn it over to you again for public session.
Well, welcome everyone. Glad you are here tonight. If you would like to make a public comment about anything that is not on our agenda, this is the opportunity to do that. We would give you an opportunity to speak no more than 3 minutes. And you can sign in. We would need to know your name as well as your address, where you reside, so that we can have that for the record. And for those who are watching online, live stream, if you want to call in, that number is 864-653-9886. If you want to follow the instructions. And you would also be limited to 3 minutes as well. So this is the time, as we like to say. Any comments? Yes, sir.
My name is Robert Lee. I live at 113 Preston Drive in Clemson, and I'm addressing a certain issue, but first I want to say generally that I'm grateful for all the conditions that allow peaceful pursuit of happiness, the way I think of it, and the people behind that, and for the Constitution from which that is derived long ago. So, this is about a recent ordinance last week, and the bias-based crime, as it was spoken of here, the hate intimidation ordinance. And after everything and considering everything, I find myself considering a constitutional challenge to that law. I don't know a lot about that. I don't know what that entails. I'm not affiliated or associated with anyone else, any organization at all right now, but I am looking into it, and I don't have time for it all, so I will forward this letter, perhaps, and if anyone is interested can read it. It's about 2.5 pages. But I'll just read you when I simplified the ordinance, and the ors and ands and all those came into full last week. Well, when I use logic and elimination and retranslate it, the ordinance translates into something fairly simple that is a different meaning that is not clear unless you look at it and analyze. So the ors and ands don't matter. They are a tautology. They are always true conditions. They cancel out. So we're left with any behavior in Clemson and any element of intent match and any element of bias match, then that person, we check the behavior. That's behavior in Clemson because it only applies to behavior in Clemson. So we don't need to check for the truth of that because it only is written for Clemson. So we're left with a pretty simple statement. One if, two ands, and the conclusion that then you're guilty of hate intimidation. Now the alarming thing is not the immediacy of what people in this room would do with this, but it's the foundation and the structure of this tool that can be used, whatever the popular bias of the day is. Just change the list. Oh, there's a great tool for official suppression of whatever becomes popular. And that's the root of my concern, and I'll limit my time to that, but I thank you for listening, and I will forward this to the general city address so anyone who can read it, who's interested can read it. So thank you for listening.
Thank you. Any other comments? Okay. At this time, I will go ahead and turn it over back to you, Mayor, and if they're, then leave it open until, oh, are you gonna make comments, sir?
I'm here representing several folks. I do have a comment about the ordinance issue. Is now the time to make that
No,
comment?
sir.
Okay. Thank
That's
you.
later on the agenda. So I'll keep it open until after the last agenda item under reports and discussions.
All right, thank you again. Thank you very much. We'll move on to the minutes. We actually have 2 minutes to look at approving. Would be July 19th of 2021. Would somebody like to make a motion regarding those minutes?
Move to approve as presented.
Second.
Thank you both. Any further discussion? All in favor, raise your right hand. Any opposed? All right, July 19th, 2021 minutes are approved. We also have July 26th, 2021, which I was not here. But I was not here. Well, no, I was not here July 19th, but I was here for the 26th. So, and I should have abstained. Now that I think about it, I'm looking at Mary, and by the way, I was not here July 19th for those minutes, but I can still approve them. Is that correct?
I'm sorry,
I was not here for July 19th for that meeting. But
so it just means that you vote.
Yes.
You shouldn't vote on that.
Okay.
Technically, you can vote on it, but it's probably.
See, I'm not used to not being here, so thank you for clarifying. So I abstained from July 19th. It's okay. Okay, thanks, Beverly. Thanks for clarifying. All right, moving on to July 26, 2021. Can I get a motion for those minutes?
I move we accept the minutes as presented.
Can I get a second?
Second.
Any further discussion? If not, all in favor, raise your right hand. Any opposed? All right, those pass. Now we'll go into reports and discussion.
Just so you know, I'm abstaining because I was not here.
Thank you. See? Chain reaction. I like that. Thank you for clarifying that. We'll go into reports and discussion. Agenda item. The first report is from the Free Clinic. Director Sandy Smith is going to be here. Thank you very much for being here. And before Sandy, real quickly, I was just going to share with everybody again. We're very thankful of the numerous nonprofits that we support and we work with. And you remember the last time we had Karen from Clemson Community Care, and now Sandy's here from Clemson Free Clinic. So thank you for being here and giving us an update. And we look forward to it.
Thank y'all. I appreciate it. Do I need to give my address? Okay, good. All right. I want y'all to know, and I know I introduced myself to Catherine. She's the only person that I didn't know. But I prepared my remarks sort of for people that don't know about the Free Clinic, and I won't take but a few minutes. But I want you to know that the Clemson Free Clinic, there are 34 free clinics in the state of South Carolina. Most people don't realize that. And our clinic is certified by the South Carolina Free Clinic Association. And not all free clinics are, but ours is. And it's a 2-year cycle, and that cycle they'll be coming back to visit us in November. And we're proud of our certification by the Free Clinic Association. Because, and as council and all, you all should be proud of that so that you know that we are meeting standards, acceptable community standards to run a free clinic in our city. But and also we have a pharmacy on site in our building. A lot of people don't realize that, and that pharmacy is licensed by the State Board of Pharmacy for South Carolina. And it's an easier certification, I will tell you that, because we don't have any controlled substances in our pharmacy, thank goodness. And so it makes it easier to run a pharmacy when you don't have controlled substances. But they come on a yearly basis to inspect our pharmacy too. So hopefully that'll make you feel good too to know that. I won't say a whole lot about COVID because I know Ted's going to talk, and he is one of our 11 providers that we have at the Free Clinic. But we've survived COVID insofar as being able to run the organization. We did most of it out of patients' cars and out and over the telephone. for at least a good 3-month period before we even let people back in the building, and then we let them in little small doses. But we did survive it, and we appreciate the city and the stances that they've taken about COVID in the community. You need to know that our budget is about $100,000 a year, which is small for a free clinic, and we are a small free clinic. The largest ones obviously are in Greenville, Columbia, and Charleston. We pay 3 people. We have 3 part-time employees, a pharmacist, a pharmacy tech, and me as the director. And but everybody else volunteers, 11 providers, 5 nurses, 2 other pharmacists, and when they work, we certainly do pay them. But we have about 15 student volunteers. They're pre-med students at the university, and they work with the physicians and seeing the patients and all that. And it looks great on their resume, and they love doing it. And I don't have to ever have any trouble having somebody come to work because they love to come and do it. The services that we provide there, most people are a little amazed when I tell them, obviously we provide primary health care with our providers that are there, but we co-partner with the Sullivan Center, and we have women's health care services for patients that's actually done at the Sullivan Center. And so that's a great relationship to be able to have that and do that. We also partner with Access Health. Access Health is a part of Prisma Health Systems, and it affords us the opportunity to get access to specialist physicians for referral services through Access Health. It doesn't cost the patient anything, and we can, go through the Prisma system, and it makes the access a whole lot easier for our patients and everything. So that is a huge benefit because we don't have a hospital here, we don't have specialists that are in the community, except some that do live here, but work in Greenville and Anderson and other places like that. We also have psychological services. We have a PhD psychologist that comes once a week and sees patients that need counseling. And of course, we could be running 7 days a week and not have enough appointments. But that's a wonderful thing to be able to offer folks that don't have health insurance, to be able to get some counseling and stuff. We do immunizations, and we do that coordinated referral service for patients. I want to tell you that we appreciate all of the council, but we appreciate our liaison with Fran. We appreciate what we had with Robert Haypaper and with Crossy before that. It's a really good thing, and I don't know who decided to do that years ago, but it's great. Fran has already helped us with problems that we've had. Robert Haypaper is, just constant, as you all know, wanting to solve problems. But so it's a really good idea, and I applaud you for doing that. We have a board of directors. Our governance is a board of directors, 18 folks, and they are mainly in the community, folks in the community, medical people, dentists, pastors, those kinds of folks, some just regular folks. But we meet, our board meets 10 times a year, and so we have close governance with them. Let me tell you real quick, and then I'll answer any questions if you have any. I told you our budget's around $100,000. We live in a very generous community. We do fundraising, but we do get from the Department of Health and Human Services approximately about $26,000 a year to provide health care to uninsured folks in the community. And then we get around $12,000 a year from the Blue Cross Blue Shield Foundation to provide health care. So that gives us around $40,000, and then we raise the rest. But now churches, all the churches, lots of civic organizations, and then our just personal donors. And we have 2 fundraisers a year, Trio and Dine with the Docs, and we raise money that way. So, financially, the free clinic is in a good position. But And then, you know, the rental agreement that we have with the city is also very much helps us with that. And it's very interesting, when I go to other Free Clinic Association meetings and everything, I always tell the various free clinics, you know, we don't pay a whole lot of rent, except I don't know whether I want to say that way. But, you know, our rent is extremely reasonable. And, you know, they say, oh, wouldn't it be wonderful to be in a city where the city did what you all have. So we do appreciate that. But any questions?
Is there anything you need that we need to help you provide?
Need to help us?
Is there anything that you need?
Anything? Oh, if there's anything we need, we'd be over here asking you. Okay. I needed help with parking. I went to Fran. Fran went immediately to the chief, to the police chief, who's delightful, and we worked out an agreement. It works fine. You know, it's a good situation. I feel completely comfortable. If I needed something, I would go straight to Fran and, you know, come to you all. I really and truly do. So it's a good feeling. Okay. Other questions?
Have y'all determined the date for Trio?
It's Thursday, December the 2nd at Holy Trinity Church at 6 o'clock. And we'll be selling tickets. Those are one of our fundraisers, okay? But, you know, I don't think I told you this, we have a patient base of about approximately 135 unduplicated patients. And those unduplicated patients in a normal year, and we haven't had a normal year in the last year and a half, normally have about 3.5 to 4 visits a year. We keep kind of close tabs on our patients. And so sometimes we see, you know, in a normal year we would see at least 350 visits. But that's not, you know, that's doctor visits. Now, that's not people that come in to pick up prescriptions and all that kind of stuff. A normal night for prescriptions, if we were in a normal year, they would be filling 75 prescriptions a night in the pharmacy. And of course, that's our biggest expense, our prescriptions. Okay? Any other questions?
I just thank you for what you do. I think it's wonderful.
Oh, well, thank you. You know, it's a real treasure to be able to help folks. It really is. Okay? Anything else?
Thank you, Sandy. We appreciate it.
All right.
Appreciate
Thank
the
you.
report.
We appreciate y'all.
Yes, ma'am. Next, we're going to receive a report, updated report on COVID-19 from Dr. Swan, and I think, Andy, you were going to lead off on this.
Say Dr. Swan's here to give us an update.
Okay. Thank you, Andy. Great. Right on cue. All right. Thank you, Dr. Swan, for being here. Yes, sir.
How's everybody doing? I thought I might give y'all an update. It's not about COVID. The state champion 8U from Clemson Central is crushing it right now in the World Series. 2 wins away from a World Series championship, and the 12U boys are doing the same thing. It's really, that's what I've been doing out there. They're playing right now.
Thanks for the update.
Okay. I'm glad to be with you guys and appreciate the invitation to give you some thoughts. I know you have a lot to talk about tonight, so I'll try to keep my comments brief and answer questions that you have. I was on vacation a couple weeks ago, and everything was great. Had a wonderful summer, masks off, no problems. Got a phone call from the lab at Clemson that we'd seen the highest viral load that we'd seen in 450,000 tests. And we knew that Delta had arrived. And so the Delta variant of the coronavirus is what is happening all across America right now. This summer we got to see it show up in other areas of the country first, and it has finally kind of landed on our doorstep. As a family physician, a community physician, talking to patients, you know, a lot of people get their information from different sources that are distant from their home. Well, the lab that we have in Clemson gives us access to information about our community that you know, I think it's pretty special. And so the things that we get to share are things we see here in Clemson, not what we're hearing from other places, but we have data here. So I sent Andy some slides this evening. This, if you can see the graph, I've got circled in pink. This is over the life of the pandemic, the different surges that have occurred. The one in the middle was this winter with the UK variant, more contagious. You can see what happened with the more contagious variant. Early in the surge, what you really look at is the acceleration as cases go up. How fast do they go up? And right now, you can see over there on the right there, things are just shooting up. So this is confirmed cases in South Carolina. I'm going to scroll up to the next slide. One of the things about COVID and one of the things about Delta and about the benefit that we have from what I call partial immunity. We have many people in the state who are immune, who have some immunity, some by natural infection, some by vaccination, some by both. But and a large percentage of our most vulnerable neighbors are vaccinated. About 77%, I think that's right, 77% of 70-plus-year-olds are already vaccinated. And so the hope would be that those vaccines would be protecting them from a serious disease that required hospitalization and ultimately death. And so I've got circled over there to the right, this is the average number of deaths occurring over the summer. And while we're seeing, we're in the middle of a surge, we don't yet see any rise in deaths. And so that's excellent. Unfortunately, sometimes deaths don't occur right away. We had a death on our baseball family this year. A grandmother of our center fielder died of COVID. She passed on the opportunity to get a vaccine, but she was on a ventilator for 4 weeks before her death. And so deaths don't show up immediately when you look at these graphs. So let's go to the next one up. This is the number of people that are actually hospitalized in the state. And I kind of think this tells the real story of COVID, because we have a lot of people who are young and healthy that might get sick but won't get very sick. But if you're sick enough to be in the hospital, that it matters to those people. And so most people who are hospitalized probably would have benefited from a vaccination. We know the CDC says that people who are vaccinated are 99.999% not going to have a hospitalization or a death from COVID. And so when we see these hospitalizations, we know where that is coming from. If you go to the next slide, this is who's on a ventilator. And so both the hospitalizations are going up and the number of people on ventilators. That data looks a little bit different than the rest of it to the left, because DHEC has changed how frequently they report who's in the hospital. So it's weekly instead of every day. So it looks a little bit lighter, but those are the numbers. And I was fortunate enough to talk to Jane Kelly, who's the assistant state epidemiologist for DHEC last Friday, trying to get an idea, since they're not showing us all the information that I like to see regularly, kind of what she's seeing. And they're observing exponential growth in all of these problems. And tomorrow is a day that we'll find out the latest hospitalization data, who's on a ventilator. And also, we just closed out the month of July. And so they're gathering important information about breakthrough cases, people who've been vaccinated, and people who have passed away even though they have been vaccinated. We're going to get a chunk of information for July in the next couple of days, hopefully, that will be very meaningful to everybody who's done all that they could to survive this pandemic. In June, in South Carolina, we only had 2 people die who had been fully vaccinated. And both of those individuals were told to me they were fragile to begin with. They were already in poor health before this occurred. And so we know that the vaccines are protecting people from serious hospitalization and death. Let's go to the next slide. All right, I'll pause there. So let me tell you about what we're seeing in the Clemson lab. We are seeing plenty of breakthrough infections. And what a breakthrough infection means, someone who has been vaccinated that tests positive for COVID. We've also seen in our community evidence of a person who was vaccinated, became sick, and was able to then pass that infection onto another vaccinated person. So that's important, because a vaccinated person then transmitted the illness. These are all just very frustrating observations and disappointments for many people in our community who have taken the effort to be vaccinated. On the other hand, we have a couple of examples where we've had people who've been sick, unvaccinated, and their spouse in the same house who was vaccinated did not get sick. And we have the ability to kind of peel back layers of the onion in the lab and examined a couple of these cases very closely. And this person who had a Pfizer vaccine continued to show absolutely no evidence of infection. So in that case, that person was covered by the benefit of their vaccine. We had a death last week in a Clemson resident, one of the people that came through our testing site, 53-year-old who had some other risk factors. Today, I talked to most of the people who tested positive today. More than half the people that tested positive today were vaccinated. Of the ones I talked to, all but one were having very mild illnesses. They tested because they knew something wasn't quite right and they wanted to do the responsible thing, and they found out that they were positive. The one person who was more moderately ill was 70, but even talking to her, it sounds like she's going to do well. Let's see. Let's go ahead to these slides. So that is what's happened in Pickens County over the last couple of days. Reported by DHEC, the cases are going up. So we're seeing the same kind of growth that we're seeing in other parts of the state. Maybe not quite as tall, but it's kind of like it's coming. A little bit of a matter of time. The next slide. This is when we have a lower sample size because we don't have just the thousands of people coming through our test site. But these are people who tested positive over the month of July and today that came through our site that do not have an address that I call the Clemson community. So we've had to define a border of what that is, and I call that Clemson Central and Pendleton, just for the purposes of this. And so these are the number of people that have come through positive outside the community. And then the next slide is the number of people that have come through. The numbers don't match up. It's a lower amount, but you can see a little bit of the trend. Nothing really was happening significantly in early July, and that's changed. The next slide puts both groups together. The blue, the darker blue is Clemson. The light blue with the green trend line kind of gives you the idea of maybe the acceleration that we're seeing, and that certainly matches what we're seeing in across the state and in other states that preceded us. I think we've been giving vaccines out of our office and out of a community vaccination effort. It's encouraging that with some of the news of Delta, we're hearing that more people are signing up to get vaccinated. I've had several phone calls over the last week, and I've personally tried to reach out and try to soothe and guide people through the decision to be vaccinated. And it's not an easy decision for a lot of people. For people, there's kind of some people that were ready to jump immediately, and if you're one of those people, it's very hard to understand why somebody has not yet chosen to be vaccinated. But there's a lot of people who've given a lot of thought. Many people have taken kind of a wait-and-see approach, wanting to make sure that everything looks safe. So my message is to people who've taken a wait-and-see, we've waited long enough, and so now is the time to be vaccinated. It really is covers your threat of hospitalization and death. We have, unfortunately, enough vulnerable people in our community who've yet to be vaccinated, despite the opportunity to do so. Our test site is awesome. This city and this community is unbelievably blessed with the resource that we have for free testing, accurate, timely, super convenient. You don't have to have a Q-tip shoved up your nose. And so as I was thinking about what I wanted to share with y'all tonight, maybe if I could get your help doing one thing, I want to make sure the community knows that this test site is there. And maybe we could share that message a little bit more, because there are a lot of people that know, but I think there's probably some people that still may not be aware of it. And some people who've not dealt with any symptoms of COVID are all of a sudden about to. And I want to make sure they know that this is here. fun part of being in a university town is you get to study things, and we have retrospectively looked at what happened with our testing during the winter surge, and we've been able to demonstrate that Clemson exited the surge sooner than other communities, and we think that timely testing had a lot to do with that. So just really a blessing. We want to make sure all of our community members know how to take advantage of that opportunity. Also working on getting that opportunity on Saturdays and Sundays also. So I'll communicate with you all about as that firms up. Just a word on masks. There's masking, the use of masks in preventing COVID has been a really contentious issue throughout the pandemic. To a large degree, there's not the kind of evidence that we would love to have, where somebody could just say, there's a randomized controlled trial, we have the hard proof that this is how you do it, and it works in these situations. We just don't have it. But there are people who have been able to investigate, and the balance of the evidence suggests that masking makes a difference. However, it's not as solid as we would like. What I can tell you is that some masks probably don't make much of a difference. A cloth mask made out of a t-shirt is probably not going to do anything. The N95 mask that I have, if I'm a case study of one person, has absolutely worked. And I've put myself in front of a lot of sick people, but I've not done it knowingly, without this mask on. And thankfully, so far, it may not last, but so far, I haven't gotten sick. And so a quality mask can protect somebody. One of my messages to people who have chosen to not be vaccinated is if they're willing to take the risk themselves to be sick, that's kind of their business. But I don't want them to spread it. And so if you're committing to, if you're hell-bent on not being vaccinated, they should be hell-bent on not spreading the illness. And so a mask, a good quality KN95 or N95 mask can do that. Another nuance about masks, we think that we see the degree of illness that somebody might experience might have to do with the exposure to the virus if somebody coughs on them or they walk into a room. If you breathe a whole bunch of it in, you get a whole bunch sick. If you breathe just a little bit of it in, you may contract the virus, you develop antibodies, but maybe your illness isn't that bad. And so anything that creates barriers that might reduce some of the viral, the amount of virus that somebody experiences could be helpful. So I think masks can do that for us, and I'm happy to take your questions.
So do you think we need to go back to at least considering some form of a mask ordinance at some point, or no?
Yeah, I think that the decision about ordinance is really your business. Medically, I can tell you that they work. Well, let me say, medically, I can tell you that my opinion is that they work, and that the evidence that we would like to have is lacking for some, and that's an argument against doing something like that. I will tell you that I think the moral imperative for a business owner to make a change in how they're putting a mask on, having masking that impacts their business. And I don't think it's the same as it was this time last year. I think the fact that people have had the opportunity to be vaccinated, we know they work. If people forego that, I don't think that's something that we should ask somebody to sacrifice their business. It's just different this time. So I do believe that a good mask makes a big difference, but I think you guys have to think about the setting and how things are different. We've got a vaccine is 1,000,000 times more effective than a mask, and everybody in America at this point that's eligible has had that opportunity. So,
Do you think there are things that we could be doing that we're not doing that would increase the vaccination rate?
I think it's been difficult, the different messages that individuals have received. It's been just a challenge of the pandemic. It's been like a whole other kind of infection. And so I think in Clemson, we've just been so fortunate to even be presenting here, sharing information with y'all, you guys being interested in wanting this, and having on the ground, what's it like in Clemson? We know we can talk to that. I wish that happened in other places. So I think in Clemson, we're doing well with that.
So a lot of people look at the wastewater and just the copies of the virus and the wastewater, understand it. With the Delta variant having a higher viral load, does that change those numbers? Or like, how should we look
Yes.
at the numbers?
So Dr. Friedman will have the best answer, but my understanding is that we may see more viral copies in the wastewater from Delta that this time last year would look like just more individuals infected. But it might be just that it's that much more virus being shed from an individual, from a group of individuals. So it would be appropriate to get him to comment on that because I don't want to speak for him. But I do think that's an open question. I haven't heard the answer.
With children under 12 that aren't eligible yet, what's the data and what's it looking like so far with Delta? And is it about the same as it's been before with the effect that we're seeing in younger kids that are not yet eligible?
So we definitely see transmission from children. And I have two of my patients today tested positive, and we think it may have been their granddaughter. And I think she's 5 or 6 years old, who had one day sneezing. So we know that children can spread the illness. As far as how sick they might become, everything that I'm aware of is not showing any meaningful difference that children are going to be sicker with Delta versus others. I want to say that I don't feel like I'm informed enough to make a definitive statement on that. That's a very important thing if that was happening, but I'm not aware of that.
But we'll probably know more in the next 2 weeks.
We'll know more in the next 2 weeks for sure. I will say I was frustrated. Boys are starting school again tomorrow, and I think that schools should be encouraging students and staff to wear masks. They cannot require it, but there is no reason why they cannot encourage it. And so the email I got from Edwards Middle School today just remarked that masks are optional. It didn't say we strongly encourage our students and staff to wear masks, but if you don't want to, we respect your decision. So that messaging, everybody has a role to play. In our office today, we went full on masks again. Regretfully so, with an upside down, smiley face. And one last comment about the conversations I had with those that tested positive today. I spoke to 8 of 9 positive people, the 9 positive today, and 6 of them had no idea where they picked it up. So they don't know where they got it. And 5 of them were vaccinated. And so it's out there, and this thing's shooting up like a rocket ship. I don't know that a good mask, I don't think a cloth mask can do a lot to stop it. I think a good mask worn the right way can help an individual. I think it's different this time around than it was a year ago with how we should act. I would like to encourage certainly business owners and pastors to be very thoughtful about the environments that they create, because you can have spread in a family where one person shares it with 3 people, but you can also have settings where one person can give it to 25 people. And one of the hallmarks of Delta, and I didn't mention this, is it is significantly more contagious than earlier versions of COVID. And the hallmark of COVID from the beginning was how contagious it was. And so the mitigation efforts that seemed to be successful previously, they may not be enough. And then the last thing is, to a degree, I'm optimistic that this is going to come. I think it's going to come hard, but it also might come fast. MUSC has been tracking estimated immunity, thinking that about 63% of the state has some kind of immunity to COVID. And Delta is coming so hard and so fast that the people who have decided not to take multiple measures of protection are very, 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 very likely to contract it. And so 6 weeks from now, 10 weeks from now, we might be in a different situation. In India, when Delta shot up like a rocket ship, once it peaked, it dropped off a cliff just like it went up. And so it's we'll just have to see what happens. The indicators that we are seeing certainly should have our attention. And my hope is that some benefit of partial immunity, the number of people who are vaccinated and the people who take individual precautions will keep us from just the ultimate tip-top peak. So time will tell.
Thank you, Ted.
Questions, comments? Dr. Swan, we greatly appreciate the update.
Yep, thank you. Appreciate it.
Thorough research and the data. Thank you, Andy, for coordinating this.
I also would just like to thank each and every one of you for the support that you've given, the opportunity to share information like this, but the city for hosting the registration link for community testing, the support that you guys, each of you came out and supported our community vaccination effort. So it's real, I just really feel like it's a wonderful being a part of the community together. I appreciate your leadership. So thank you.
Thank you for your leadership. Appreciate it. All right. Our next item is to discuss the beginning of a 10-year.
Did we close the public session?
We haven't closed it yet. Hey, I'm fine.
Close
Go
it.
ahead.
Go ahead and close off, waiting for the other two reports.
We can.
Okay.
We were just waiting until the end session.
Okay.
You just didn't want to talk in?
No, I didn't feel like
I'm just kidding. All right, so let me start with, we're going to discuss the beginning of the 10-year rewrite of the comprehensive plan. Councilman Brookover, and I'm going to come back and get some more chairs when you're done, but I still can hear you.
So, in the strategic plan implementation committee and through some other discussions, and given the recommendations in the strategic plan, and making sure that they are, our comprehensive plan and strategic plan are in alignment with each other. Todd has done some initial work on lining the strategic plan recommendations up with our comprehensive plan. There is overlap, but we are quickly approaching our 10-year rewrite, and there has been a discussions about potentially just going ahead and jump starting. There's nothing that says that we have to wait the full 10 years. And there's, our comprehensive plan is a massive document that's not really overly modern from a comprehensive plan perspective. So wanted us to get this on our radar to begin considering moving the beginning of that process up. And certainly this time around, strongly considering bringing in a firm to assist us with that process. And that's all.
Comments, discussion, questions?
And that's in keeping with what we said when we approved the last update, was we would start sooner rather than later since we got through the white paper process. So it's time.
And I may have messed up, but obviously you saw the model Greenville.
Yeah, there's, yeah.
So
Yeah,
it's a good
lots
model.
of great models out there. Lots that make it way less unwieldy than it currently is, and understandable and approachable by anyone. Right now, you would
What do you think is the
need to set aside some serious reading time for a month to get through ours.
Nothing wrong with that. What do you think is the budget for this?
It could be as much as we want to spend. So that's a wide.
I'm a woman. I know that's true
Yeah.
for anything.
Yeah.
I'm
So-
wondering for the budget.
It depends, and we need to think through kind of what approach we
Right.
want to take. And I think the approach that maybe saying, hey, we like these couple of models, will give us more information. I think we're going to get to that point before I'd be comfortable
Okay.
even beginning to give you an estimate.
I think one part should be, in addition to there being a 10-year plan, that maybe you look and do a piece of it that's maybe a 30-year plan or a 25-year plan in addition to that. It may be somewhat abbreviated, but at least it's direction.
Well, I appreciate it very much for that report and setting the expectation. Item D is discuss setting maximum speed limit. Chiefs here on city streets. There's Chief. Thank you very much for coming. Yes, sir.
Mayor, member of council, thank you. Last month, the Police Advisory Board had a discussion item about this, and I know this has been discussed at different forums of what to do. Currently, the South Carolina Code of Laws would set a standard of a municipal road that's not posted to 30 miles per hour. We have a lot of streets in the city that are either not properly posted, and unfortunately that defaults to 30 miles an hour, and a lot of those streets are in residential neighborhoods. So the law does allow for the council to, or whatever governing body for the city, to set the speed on the roads. And what we had discussed, there were a couple things that we had discussed, and the recommendation from the board was to recommend to have a maximum speed limit on municipal roads or city-owned roads to be 25 miles per hour, unless other circumstances exist to warrant it being lower. And some of those examples would be roads that have speed tables or speed bumps need to be lower than 25 miles per hour because of the obvious hazard of going over them 25 miles per hour. So there are a number of things that we do now currently if we're going to depart and go higher in speed or lower in speed, such as speed study and other things. We did discuss this. I did discuss this with our city engineer, who has a background in this, and he's here to talk on, ask or answer any questions. He can speak for himself, but has told me that he's in support of this. One example that came up recently, I know it's still a development that's not complete, but Patrick Square had no speed limit signs put up, and some of the residents of Patrick Square were a little concerned about how fast people were going through there. And so under the current law, it's 30 miles per hour through there because there's no speed limit signs. So through planning and everything, we're looking to rectify that, and my recommendation would be that it wouldn't be any higher than 25 through there. But I'd like to set a standard through ordinance that says any municipal road, whether posted or not, if it's not posted, it's 25, unless otherwise posted at a lower speed limit. And that, I think, will help planning and anyone else when new roads go in and whatever, that sets the standard, and we don't go any higher than that. Now, with that said, I'll also bring to your attention that we don't have control over county or state roads. So there are a lot of roads in the city that go through the city that are county and state roads that we cannot put traffic control on those roads unless we work with the State Department of Transportation. And one example is, and they're roads that you would think were municipal roads, but they're not. One example is Rock Creek Road that runs from Pendleton Road to Berkeley. That is a state road, and they set the speed limit on that road. But all of the feeder roads on that road are municipally owned roads, and they're usually lower speed limit. So we just did a study in that neighborhood not too long ago. We had some issues with folks who were coming down Pendleton Road, going on to Cedar Lane to cut over to Clareton Road and go down that road, and they're coming off of a 30, I think it's 30 or 35, and then they're going on to a 25 and not really slowing down. So we're working with the state at that intersection to do some rework of the traffic control to try and slow some people down. So this ordinance won't be the end-all, be-all. We'll still have to work with the state in some areas and try to get folks to understand that. There might be some citizens here to talk about this. I'm not sure. I was told at least one might be here. I don't know. And since I met everybody like this, I'm not sure who that person might be. But any questions?
So just a quick one. I think, so we talked about this at the Traffic and Transportation Committee also. They were talking about, and this is not something we voted on, a suggestion, 20 miles an hour. I think you had some concerns about that. So why 25? Is that a standard? Is it
I am recommending 25 because that is pretty much the standard in most residential neighborhoods elsewhere. So one of the concerns that I had was if we set it lower than that, we would be putting ourselves in a situation that we're kind of like an island. And so when people visit the city, they're not really thinking about a slower speed sign. So one example that I would use is, and you have it, it's not really the same here with Clemson University, but I know the University of Florida has a 20-mile-an-hour speed limit across campus. And every ingress and egress road onto campus, you have that sign right in front of you that says 20 miles an hour, campus wide. If we did something like that, we would probably have to put signs up like that in a lot of different areas of the city so that people have fair warning of the speed limit change. There is a state statute that says that you have to have proper notice about speed, and so there may be a little bit of a challenge with the signage if we go below that. If we have more defined boundaries, it might be a good idea, and in some neighborhoods, depending on the design, and I'll default to Chris, it may be a good idea. Chris can even talk to some neighborhoods that are designed specifically to keep traffic slower, but the problem is that development is to its fruition. It gives a different appearance, and then the drivers drive a little bit faster. And so in that situation, we would have to post it to keep it down if we're going to enforce it.
Are there any roads now that are 20 that would go up to 25, or they would stay? Are any roads at 20 right now?
I'm not aware of any that are 20, but we have several that are 15.
They would stay that way?
They would stay. So the ordinance would say if it's not properly posted, it's 25, unless there's justification to depart up or down, depending on, we may potentially have a municipal road that's not a state road, that's an artery road that might warrant a little bit higher speed. Rare, but it could. But we would have to justify that through the engineer and whatever study that we did.
Thank you.
Other questions, comments for Chief?
I'd like us to think about collecting a little data from like walkers and bikers, and maybe do a few experiments for pedestrians to see cars at 25, 20, 30 miles an hour, to determine, where people feel the most safe when they are not in their vehicles, because you do share the road with walkers and bikers, and we have a community that isn't particularly walker or biker friendly. And as someone who walks with their family daily, sometimes multiple times, I can tell you that it's, slower's better, and not super slow. Not super slow, but even 25 to 30 miles an hour with a car when you've got a kid and a dog with you, and people not paying attention to driving, to how they're driving, and often faster in many of the neighborhoods. It's not a great situation. So
I'll give you a traffic vest and have you direct traffic with me in the middle of the road, and we'll see how fast cars
Oh
go.
yeah, I know. Yeah. I'm the grumpy old man that yells at everybody.
But to that point, we have been using our traffic measurement equipment and doing traffic studies, and I do have data from various areas of town. We currently have one of those in Patrick Square. It's recording that information, and we'll run a report on it. And we can present that. I put a sign on 123, people coming across the Oconee Bridge for several weeks, and I have that data as well. And yes, I'm aware of the employees that are going from one side of the road to the other down there. That concerned me greatly when I saw it. But even this morning when I was at the detour and road closure for the hotel, and making sure that we had all of our detour signs out properly, people traveling down College Avenue too fast, in my opinion, and that's a 25-mile-an-hour zone right there. So it's a challenge, and traffic is definitely something that we take a lot of complaints on. So this is, I think, just one step in that direction. And like you said, we may set it at 25, but there may be conditions, pedestrians, et cetera, that warrant a slower speed limit. But we would have to do that study in that area and go from there.
questions, comments? Chief, we greatly appreciate you for presenting this.
Thank you, Chief.
Thank you very much.
Thank you.
Looking for Chad.
Chad's back there.
Chad's not here. I believe, Andy, you're going to do the receive a funding announcement from the Green Crescent Trail since Chad's not here.
Yeah, he was just going to report to y'all that he's been working with Representative Jerry Carter and to get some funding for the Green Crescent Trail. He successfully obtained $200,000. That should be paid sometime around October. And he'll be meeting with Chris Shiver this Thursday to try to figure out how they can best leverage that money.
And just to add to that, it was also Senator Thomas Alexander, and it was also Bob and I, just to make sure everybody's aware of that as well. So,
And the first signs are
Yes, first walk signs out.
I was going to bring up something related to that as a council report, but it might be more appropriate here. So we did have a discussion, if you remember, right at the end of the budget process, that we did not do a really good job of considering a permanent funding model for their request, and that we did have a discussion in a sense of the room that if Green Crescent was successful at getting grant money, that we would look for opportunities to help match and things like that if it goes beyond what we do have budgeted for this year. So I would hope that we would continue to do that. Also, I sent them yesterday or the day before, there is a major funding opportunity for trails and outdoor recreation with the American Rescue Act that was just announced last week. Potential big funding, and I would like us to, and Andy, however this would need to go forward, consider getting that organization some help to write those grants, potentially, if they would like it, some professional grant writing help, because it's going to be, I think there's $240 million and grants of up to, I think it's $10 million that you're eligible for. So this is an opportunity that if we go after it, we could, again, stretch and find some matching money. This could be a game changer to get some significant trail on the ground. So I want to put that on our radar and make those requests that we continue to consider that and support that project, because we have probably heard more about the need for that in the last several years than almost anything else. Thank you.
Have Lindsay need to sign up for a seminar.
Yeah, and I think Heidi is going to the seminar as well. But again, this is going to be a big, complex federal program that it might be worth spending a little bit of money to get a professional involved as well, if we feel like they need it and they want it.
The Council of Governments do that work.
Yeah.
They do a good job.
they do.
They complex federal grants, I'm glad they pay them.
Appreciate the comments. Staff reports, Andy?
Yeah, August 21st is going to be a Rotary Park ribbon cut. Do you know what time that's been scheduled for, Beverly? I got the date down. 5 to 7 at Rotary Park.
What day again? What day again?
August 21st. I'm just reminding y'all that you have your workshop interviews this Wednesday from 1 to 5. And I need 3 to help serve on assistant administrative selection. I've heard from Frank Robert Alicia. John said that he'd do it, he'd really rather not. It's kind of interviewed out, but step up. That's what I've heard from Colson Reed. I want to do that to y'all too.
I'll do it if you need somebody to do.
I refuse.
As well, yeah. But if somebody else, yeah.
We have 2 minutes.
I told I'd pass as long as y'all went between the administrator, the chief, the judge, and the, let somebody have a turn.
You're full up.
Let somebody have a turn.
All right.
Catherine, Robert, and Elisa.
Does that work for everybody? Okay, there's your answer. Thank you. last thing I have to report is that is taking a very good opportunity for them and the funds. City engineer. Did he leave?
He walked out before you could say.
Jeez, did he intentionally leave?
He has certainly served us well.
Yes, he's done a wonderful job. He's been very thorough. Thank you, Andy. All right, moving into policy action, agenda items, and the public comments, you can dial in at 653-9886 and follow instructions. And there is a 2-minute limit per speaker during public comment during each of our policy and action agenda items. And we did find out from the last meeting that you cannot share minutes, so just keep that in mind. It's 2 minutes per limit per speaker and not shared minutes. So if you have any comments, please keep it to the 2-minute limit. And so we'll go into the first policy action agenda item is consider second reading of the strategic plan ordinance number 1. And Todd, I think you're going to do the opening on this.
There have been no changes since the first reading. Be happy to answer any questions.
Questions for Todd? Okay. Any other comments from City Council? Comments from public? Yes, sir.
Yes, my name is Andrew Ias. I think I'm rising at the right time. I'm an attorney in Greenville at Nexon Pruitt. I was retained by 8 property owners in the city. If you're my client, would you stand, please? And I was just retained today, so I'm just getting up to speed. But I was retained to provide advice, and hopefully the council will come to a solution to a problem which clearly exists. The university is growing, more students are coming here, and there are actions that need to be taken. And my clients hope that those actions are something that they can live with, but also something that complies with the law. They do not want to file litigation. I'm not here to be bombastic or threatening. It is something that they wish to avoid, but something that they are prepared to do if necessary. As I said, Clemson is growing and the law needs to be filed. After looking at the procedures that have been followed and the amendments to the various ordinances that have been proposed, I have problems with them as a lawyer. I think that there are issues with them. I would encourage you, I'm not your lawyer, as you know, but you do have a lawyer on staff, and I've read her notes that have been published and published to the public, and I agree with her in many respects. And she has cautioned your use of the planned development statute in the way that it appears that you're intending to use it. It is not in keeping with the statute as it was enacted and as it would work in an ordinary zoning process. My folks have not wanted to hire an attorney. They know that the second reading of this was coming up today, so that they did hire an attorney. I've reached out to Rivers Stillwell, who I think has been here and you all know. He's filed a lawsuit recently. My clients aren't all situated in the same way. They don't all have developments that are ongoing or even have their property listed. But all of my clients have some of the claims that are in that lawsuit filed by Rivers Stillwell, and some of them have more than others. In my opinion, it is the city's job, obviously, and this isn't my opinion, it's a fact. It is the city's job to zone and plan for growth. Growth is happening. I was a student here years ago, and downtown didn't look like it does now. There's part of me that wishes it could be like it used to be, but that's not the reality that we're in. The university is growing. More and more students are coming. They have to go somewhere. Traffic is an issue, and downtown makes sense. It would certainly alleviate many of the traffic problems. And as much as my opinion would like things to stay the way that they are, that is not happening. I know that many of you share my opinion, and your opinion does matter. You do have votes. You can enact zoning ordinances, but they have to be in compliance with the law, and that's all that we ask. And I do ask again that you listen to your attorney. Thank you. And now I'd like to invite any of my clients to speak if they wish.
Excuse me.
Oh, yes.
Anybody going up to the mic, if you would just leave it like this, it'll pick it up. We'll get feedback when it gets poked back up. Thank you.
Thank you, Lowell. Other comments?
You guys have heard me say this before. Trying to force PDs on any size parcel does not meet the requirements of the Enabling Act as a definition of a PD. You can pass it, but it's not lawful. And we'd love to work with you. The economic effect to commercial property owners in the city is estimated to be in the range of $50 to $100 million. If you pass it, we'll be forced to get an appraisal, and we'll be forced to go against the city for damages. That's multiple times your entire city budget. It will go on record that you guys were the one that passed it, and that the city will be responsible for paying those fees. And it can be avoided. There's alternatives to this, but if you go ahead and pass it, we have no choice. You know, I held out an olive branch. You know, we're trying, but you can't take away that kind of money from property owners. They bought their property. It had zoning rights by right, and you're taking them away. That's called a taking. You can talk to your attorney about it. I sure wish you'd have a public discussion with her and her notes right here so everyone could hear her advice. I've read her comments to you. But you're either going to pass it or you're not. But there will be consequences. So that's all I can say.
Oh, you gotta sign in. Ms. Beverly cleverly put the note over here, so we have to. Thanks.
Other comments? Yes, ma'am.
Hello, Council. My name's Elaine Masseri, and I'm a resident of Clemson. And these comments are to the developers. You are directing your complaints to the council when in fact you should be criticizing the residents of Clemson who about 2 years ago signed petitions which set into motion the moratorium. We are here tonight because the residents have directed the city to address their grievances of unbridled development, such growth which results ultimately in higher taxes to support more emergency workers, sanitation workers, infrastructure, police, and a litany of other services. Quite frankly, we've had enough of horizontal and vertical growth, sprawl, whatever you want to call it, which results in poor construction, empty commercial properties, poorly managed rental property, invading our neighborhoods, and traffic congestion that encourages residents to avoid Clemson and spend money in adjoining towns and counties. The council has been directed to address these issues. Let them do their job. Get over it. Thank you.
Ms. Misery. I'm gonna pay you back. Little.
Hello, my name is Lillian. I'm a resident of Clemson. I think I've spoken to you all at some point or another over the past however many months we've been dealing with this. This is not an issue that is without emotion. I know that you all feel it, I feel it, everybody here feels it, no matter what side you're on. And they're not unwarranted emotions. I understand frustrations from both sides. This lawyer says he went to Clemson. I went to Clemson a little bit. And the city is changing drastically. I lived here in high school, and I now have a child going into second grade. It is completely different than it was. And while growth is inevitable, you can't avoid it. We shouldn't avoid it. We want to grow and change and bring in development in a responsible way. I know a lot of people come up here when they don't like what you're doing, so I just wanted to come here and thank you for listening to what we have done over the past year. And tell you that there are people who appreciate what you're doing, so that the only people up here aren't the ones complaining. So thank you.
Ms. Brewer.
Other comments?
Rick Ware, 100 Holiday West. First of all, I'd just like to say that I have utmost respect for teachers, professors, and our law enforcement, primarily because I wouldn't want to do their job. I'd probably be in the jail before I would do their job. We've had 10 years of student housing development that brought on a moratorium, and it has been, as Elaine said, unbridled growth. And I do think every city has the right to change its zoning, to make it be the city that it needs to be for the future. I don't think any of us, I know when I was here at Clemson, in 81 to 85, I would have never thought we would grow to be a 30,000 student college or university. And when you think about that, you've got 2 to 3 times the number of citizens. I mean, the number of students are usurping the number of residents here. Yes, it is true that we have traffic and all the other issues, and I feel for the guys who are saying, hey, you know, it's our property. Well, we own property here too as citizens. There's things that I've talked to some of y'all that I'd like to see us change. I've talked to zoning and codes, and I've been through our codes and zone upteen times. There's things in there I'd like to see us change. But we have to start somewhere. We have to start somewhere. Why student housing? I said this a few weeks back, $4,000 for 1,400 to 1,500 square feet. When you think about that, that is a lot of money for that small amount of square footage a month, $4,000 a month. I'd probably say that most houses in Clemson can't get $4,000 a month for a 4,000 square foot house. I mean, I tried to look at that. And as long as there's those large profits, there's going to always be people who want to build one thing, student housing. They're not going to be interested in building affordable housing for other people. The numbers don't work for them. If you can get $4,000 a month for that small amount of space, you can get more for your property. Bottom line, it's all economics. But, you know, I don't know how many of the guys here tonight that are are own property owners, how many of you live in Clemson? 2, 3, 4. So, you know, you're feeling the same pain the rest of us feel. But, you know, you guys were elected because we want to change. We've got to change. Thanks.
Other comments?
Hi, I'm Charlie White. I live 215 Kingsway in the Camelot subdivision. I've spoken to y'all before. One thing that I don't think has been said tonight, maybe there's been an implication of it, but the city held public forums a couple of years ago, and out of those meetings, there were a number of issues that the community felt needed to be looked at, studied, altered in whatever way that could be altered, because they had these fears that the growth that they saw, that we saw, was beginning to surpass our ability, the infrastructure for taking care of those kinds of properties. And the moratorium asks you to slow things down, stop things for a while. Our request was 6 months. It's been about 19 months now. You guys have been continuing to extend the moratorium. There's been a lot of work. I think the committees that are involved are getting closer to making some specific recommendations, some of which may be quickly put into effect. Some may take 20 years to put into effect. But the issue is the development is surpassing our ability to support those developments. And I certainly think the council and the city has a right as a whole to say, wait a minute, we don't want to be buried under all of this growth. So just want you to understand that one of the big issues is where's the infrastructure to support all this stuff. Thank you.
Lowell, do we have any calls? Lowell? Okay, just make sure. Other comments? Any comments from city council members?
I'll just do my usual. I think it's, obviously we had the right to change zoning. I don't think a strict PD path, even in the short term, is appropriate. I feel like there should be a by right component for people to develop their property, more stricter perhaps than what we've had. You know, maybe it's 40 feet and then set aside something in reserve for the commercial area, but to take away 100% the by right ability to develop them and put them through a PD process, one, it's not efficient to have that many PDs. Two, the process of a PD, since I've been on council, we've made some major amendments, but the only 2 PDs that really come along never even made it out of the hearings. I mean, it was very clear. So PDs are expensive to do and don't have a real great track record of progressing lately, which is fine. You've got to work with them, but it's at the whim of 4 council members. So I think people do deserve some sort of by right ability. I believe it was Dr. Gosnell described his property 2 meetings ago, a single-family home that's an office that could not be converted into a house again, where he could have a house and a part of a single-family home. You couldn't even have 3 condo units. I mean, I just think we're overreaching by limiting this to PD zone. I don't think that's appropriate. We had a 6-month moratorium. I think we're on month 20 now. And while we may feel like we're moving fast in some respects, we're not. There's an expectation set that things are done more quickly. So they haven't been. We're moving as fast as we can to rectify that. But I do feel like as we make that path forward, even if it's more restrictive, something that would not be conducive to the larger developments that people are opposed to, there does need to be a by right component for people moving forward.
But John, if I'm not mistaken, everything is still by right unless, and Bob will correct me if I'm wrong, unless you want a multifamily residential component.
Unless you want residential in there, a
Right.
residential
And
component.
so if I take my commercial property and create another commercial property, I can still do that by right.
I feel like you should have a by right to have a residential component to it, and I'll rephrase that. I feel like you should be able to have your office building and 3 condos. You can't do that with this.
So the intention here, again, first of all, it was an unrealistic expectation to think that a strategic plan of this size and scope and complexity could be done as quickly as original. And that's something that we're dealing with now. But typically these processes take between 12 to 18 months to complete and get to a report. I'll say it again like I did last meeting. We're not even at 18 months from when the consultant started yet, and we are really close to big time implementation coming forward. We are interviewing the final 3 firms on Wednesday for the redevelopment process for the properties where everybody that's in this room is a property owner has property. You will be centrally involved in that process of us coming up with getting to the point of a shared vision that is economically feasible and implementable going forward. And that is the main outcome of that process. I asked you all last time to be patient. I hope you can hang with us for another few months as we get through that process, because I think at the end of the day, almost all of you are going to be, all of us, and not everybody's going to be happy, because this is Clemson and we never are. But I think we can get to a place that that most of us can agree on that's the right thing to do for Clemson. The moratorium had been extended. It was still in effect. I was not on council when this became a pending ordinance, which at that point, the decision could have been, let's keep extending the moratorium where you don't, your path forward during the moratorium. You still could have brought forward a PD during the moratorium if you met the 2 acres. We've amended that so that you still do have a path forward while we can get this final piece of implementation. That will likely come back in with catalyst areas and overlays that will put back in by right as the process unfolds and what we do. We could go back to a moratorium if that's the preferred state to give us the time to implement. I'm fine with going back to a moratorium, but right now we will have wasted a great deal of money that we've put into this plan, and time, and people's time, and your time, if we allow it to be, again, just opened up, let one-off, monolithic, one type of development happening in our downtown corridor. There is not an expert witness that you could get up in this country that would be legitimate, that would say that that is a healthy development pattern for any town, anywhere, and that the city should have a reaction to that. So I'm asking you again to please be patient. We have given a 16-week time frame. That's
correct.
We are hoping to make a decision on Wednesday to get that group in to go through this process and get them started as soon as we can get a contract executed, which should be hopefully at our next meeting. So please hang in there.
Let me add to that if I could. We are not preventing, people Bob said, residential development on commercial properties. What we're looking for is a cooperative process to do that rather than a contrarian process to do that. You can still go through the PD approach. And I respect what John said, but as I said at the last meeting, since 2016, 2017, 4 PD-related actions have come before this council. 4 were approved. 1 was new and 3 were modifications. Now, if people chose to not come to this process, congratulations, you can read my mind apparently. I don't know why you didn't do that. Maybe it was a tough go. Frankly, what this does is it makes it a cooperation between the person wants to build, and the needs of the city, which is what a PD process would do for us, to come up with a plan. I think there is some discussion about maybe changing or modifying the PD process a little bit to make it more open, more honest, and I would ask you to join us in that approach. But it would be a mistake to say this prevents residential. What this does is this makes residential maybe a little bit more difficult, but also makes it more appropriate and more agreeable to the entire city as opposed to just one segment of the city. Someone, I don't know how you do this.
John, yes, sir.
I appreciate what you're saying about being patient, but are you going to go ahead and pass this change tonight?
Well, this has been a pending ordinance since November of last year. We've gone through revision after revision of it. So it's on the agenda to pass tonight. And again, it still gives you a path forward for residential. It's a slightly higher, it's a higher bar to get across. We had a developer in here for our work session earlier asking to be annexed into the city as a PD, who has done a PD in the city before and brought in a property as a planned development and asking for that process potentially. Whatever the perception is, it doesn't match the reality of what has happened with PDs that have. PDs are more difficult. There's no doubt about it. But history has shown that if you keep going with them, they've had a high likelihood of being approved. And it's a path forward instead of nothing.
I think to answer your question, yes, we plan on voting on this tonight as we go forward.
Can I make a motion to
John has.
A couple of things that seem to be, I think, get lost in this deal, and maybe we need to establish a timeline tonight. Basically, as close as we can come to, an end date or a drop dead date or whatever the case may be. But the intent was just to get to the finish line. We have spent a lot of time, a lot of money, and right now, if we just let it go, we've wasted all that time. We've wasted all that money. And again, Bob said it before, others have said it, again, I'd like for everybody to consider to be patient here. I do believe at the end of whenever that timeline is, whenever we establish that timeline, that the PD process will not probably be like it is right now. That's not the intent. That's not the intent at all, to make it difficult. But I do believe that if we have an opportunity to put this together and we can do it in a framework that, everybody's involved in, all of you, all the developers, all the people here that own the property, please be there. All the residents, please be there. Let's all sit down at the table and let's come up with a plan that works for everybody. The intent is not to see Mr. Johnson lose any money or anybody else in this room lose any money. That's not the intent. The intent is to try to put something together that, quite frankly, becomes possibly the gateway for Clemson, where everybody wins in the deal. But I can't say there's going to be no losers in the deal, but at the end of the day, I'd like to think collectively we can come together for something that works. But at this stage of the game, I think we need an ending date. But I beg everybody, there's a lot of eyes in this room, but there's no I in team. Let's be a team. Let's be Clemson. We've been Clemson as a group together. Let's give it a little bit more time, just a little bit more time, so we can all win instead of just a few feel like they win when in fact they may actually lose.
And I'm just going to add to what Bob was saying earlier about the 16 weeks. When we've been talking to the consultants, we've actually talked to the one that we've had so far. We said it would be a 16-week time frame to end this. And like Bob just said, the actual meeting itself is August 16th, that we anticipate the agreement being signed with that consultant group to move this forward from an implementation side of things, from a community vision side of things, and what everybody's saying on the intent of moving forward with our city in the right direction. So.
The only thing I'd like to add, I don't think we said that at all, is because this is about the community as a whole, and I think everybody's perspective is important. But our residents, our property owners, individuals who are part of this community, we have a vision, we have goals, we have objectives, and we want to make sure that everyone's input is provided. And so that's why we're asking you all to be patient, because we are trying to do the right thing for all of our residents. and not just one particular group of residents. And so it's so important to hear from everyone, to talk through what's important for Clemson in the future of Clemson. And I understand economically the financial aspect, but at the end of the day, our residents, what we want to do for Clemson in the future is where we as a council is the most important thing for us to consider. And so we had several members get up and talk about the voices and what they had, you know, what took place and why the moratorium was put in place, to put a pause, so we could come back and take a little break and look to see what direction should we head in. How can we be strategic with our growth and our development? Because we know it's inevitable. It's going to happen. But what does that look like for the city? And I think that's the most important piece. And so we have to either be together and work together, or we just decide to be divided. But I think this is just to help us move forward as a community. And I think that's the most important piece. We got to be able to listen to each other and hear each other. And right now, I think we're at odds because we're not able to do that. But I think it's important to hear, as developers, from our residents who actually have some concerns. And then, of course, from our residents to hear from our property owners as well. So I think that's the most important piece.
So I'd like to make a motion that we approve on second reading.
Yeah, we've passed public comment at that point. Once we start talking, that usually ends.
Well, I was going to defer to Mary if she wanted to add anything. So, no, okay.
Do you want to recognize him?
I think we should.
Yeah, go ahead.
So please, yes.
You mentioned the team, everyone being on the team, and one of the things about being able to get excited about a team is really knowing what the plan is. And that's one thing I feel like that there's a little division here as far as, you know, as business owners really being able to get on board with the team, just knowing that, hey, in all due respect, I know that you mean that meaningfully, but it's just kind of hard to have that perspective when you really don't know what the plan is. I kind of have a hard time signing up for that football team. I just had to, you know, didn't really know what the plan. And I know that you all have a good focus and are, you know, really want the best, but there's, you know, some of the rules don't always make sense. You know, we see a lot of empty retail space, you know, because that's part of the focus that had been set in there, that, you know, we got to have a balance of retail space, but now they have to charge more for the apartments because they have to cover a lot of the empty spaces that are down there a lot of times, from what it looks like to me. But as a smaller business owner, you know, sometimes it kind of looks like you have to have a bigger corporation to really be able to afford to do some of the things that you hope and dreamed about, because, you know, the PD is going to really eliminate a lot of some people being able to accomplish what they want to be able to bring that big package together. Maybe it is and maybe it's not, because I don't really know what the plan is, you know, or what that goal is. But and I see that might, you know, you look to see a lot more, some more vacancy, some people not being able to have the potential to do with the property they want to be, to really bring it to a level that could really make a bigger difference in the community here. So, just some of my perspective there.
So just to respond real quick, the first thing is that we don't know what the plan is for that area either, and that's what the next 16 weeks will be about, is getting you all, the community, and everyone on board with the consultants to come up with a vision and a plan for what that could be, what that entire area could be, what the zoning regulations should be, what policies should be, what the look and feel should be, what acceptable uses, and again, it's going to be approached from a perspective of economic feasibility and implementability and be, in hopefully a sweet spot that's good for you all and it's good for the community. Because, and again, the economics of student housing and that empty ground floor commercial is because the beds are so lucrative, they do not need to ever fill that commercial space, and they set the rents at a rate that makes it extremely difficult for anyone to open a business. Could you afford, starting today, would $31 per square foot work for you from a lease rate? Would that make it difficult for you to start your business today in one of those empty spots if you had to upfit and everything else? It's called Tom Wincott, a developer, calls it raised crawl space, and that's how the developers that he works with, by the way, look at it. It's a raised crawl space. We don't ever have to fill that because the beds are so lucrative. Again, that makes your commercial district where you have commercial zoning to allow for commercial uses useless. And that is terrible from a zoning perspective. It's terrible from a business community perspective. It's bad for a lots and lots of reasons. So it's not to say that I don't think I can personally say I'm not against change. I'm for change. I want to see that part of downtown. I'm realistic. I know there's changes that can be made and should be made. And I can speak for most people up here. I don't think we're anti anything. We're not anti anything. And the plan and the team, that's what the next 16 weeks is about, and getting your input and the community's input into what that plan is.
I was just going to finish with one more thing. As far as residential areas, I don't think that they would really like to have to lower the values of their property, just be able to have more affordable property for other people to be able to move in here as well.
No one's saying that's a goal. That is far
I know,
from
but I'm
being
trying
a
to
goal.
put in perspective of your commercial versus your...
And again, I don't want your commercial property to be less valuable. And again,
So I'd like to make a motion we approve on second reading strategic plan ordinance number 1.
Have a second?
I'd like to make a secondary motion that it sunset on December 20th, 21st. That is 18 weeks after our August the 16th meeting, which is 2 to 4 weeks beyond when we expect our result back from the consultant. The true intention of this is to layer back in buy right components for people. We'll have the report for 2 to 4 weeks at that time. So I think it's appropriate for this to sunset and for us to readdress it at that time.
But before we do
just
that,
make sure, what date was that?
December 20th, that's our second meeting in December, which is 18 weeks beyond our August the 16th meeting, which we will be approving the group for 14 to 16 week process.
so you do realize we can't put together a zoning
We do a
package.
second.
Well, before you do, I'm going to give them
I
a
want to
chance
make
to
a
change
motion.
it. So I'm going to make a friendly suggestion. If we let it expire at that point, we will not have the zoning in place.
We need a second. Do we have a second on the time frame?
I want to, wait a minute, I have a second. I want a time frame, but I'm not certain I want to do so much more.
That's what.
Can't discuss it.
So you can't discuss it.
Can't discuss it.
Can't- You can make another amendment. All right.
So, okay, I second it, but I want to amend, I'd like for us to decide to amend that date. I think that December 20th is a little tight. It might need to be like January 20th or whatever the date is. I'm not looking at the calendar, but at least give 30 days to come up with some zoning recommendations. I think that you've got to do that. Because if you heard you heard the thing the other day, I mean, they feel like they'll be in a position to make some recommendations at that time, but then you're going to have to go through the process to make the changes, which means probably you're going to have to drop in with another pending ordinance, which I don't think we want the appetite for. That's not good at all. So I do think it's important that we do sunset, like I do believe that, but I think that we, in all fairness to the process, we need to give at least a minimal amount of time to be getting that.
Our first meeting in 22 is January 3rd.
No, but I was talking about like the second meeting would be what?
It'd be, actually, that's Martin Luther King Jr., so it'd be January 18th.
Then I amend I think I'm doing this right. I amend the motion to January the 18th.
I don't think you can amend a motion that hasn't been passed yet. I think first we have.
He's moving. Do I have a second for his movement to amend? Do I have a second? I will second that. All right.
I still think we need more time
Any
than that,
fur-
realistically.
I really don't understand. Explain me what sunset means. If we don't meet that deadline, what happens?
You go back to the original ordinance, just to be clear, you go back to what it was before this, so it gives you a timeline to get this accomplished, what we said we're gonna do. If we don't, we can also vote in January to extend this again or move it forward, so you have all your options on the table. But if you took no action before January 18th, you did absolutely nothing, then that would go back to what the ordinance was before we ever had a pending ordinance. So
I
it
think
puts the pressure on you to get some things done, what we said we're gonna do, it puts some follow through in there.
I seldom disagree with John, but that's risky business. If we really think we want to amend this at some point or drop it, we can do that without a sunset. We can meet on any day we want, and you can make a motion, or anyone on this group can say, I move that we rescind what we approved tonight, if we approve it, and we do this instead. Sunset clauses, just like the deadlines theoretically for the Clemson next plan, become handcuffs. They don't become facilitators. They force you to move and make decisions you're not ready to make. We can make this decision sooner or later, and based on that, change this thing if we approve this tonight any way we want. But I think to put over the sort of the process, the deadline gets in the way of progress, strangely enough, not favoring it. So I don't disagree, John. If we don't do what we think we need to do, that we come back and talk about this. But I disagree with putting a deadline on that. That becomes a handcuff rather than a facilitator. We're going to move, I know we're going to move as expeditiously and as quickly as possible. We're not going to go slow just because there is or isn't a sunset on this. We're not going to go fast because it is or isn't. But I think a deadline, I don't know how the ordinances with deadlines, is a very difficult position to put the decision-making process in. So I'm going to speak against the amendment. I don't see the necessity or the value of it. I understand the point, but I don't see the necessity. I definitely don't see the
Further
value.
discussion, John.
I disagree to some extent. I think it's time, we've been hearing both sides, and the developers have been very persistent about what they've had to say. And I think at the very least, we need to show them good faith that we intend to finish this as quickly as possible. And yeah, we might have to come back and do something differently like that, but I think if we leave it wide open, we haven't showed them anything. And I think it's time we at least show them the fact that we intend to complete this and get it there. Because I've said to them already, be patient. I think what we're proving tonight as far as the PD piece is just a step. And I honestly believe by that point in time, we can go back to something I think is going to be more likable to everybody involved, including the developers.
But I think to put it in ordinance makes it more than an intention. It makes it a requirement. We can vote on this, and then after have a discussion of an intended finishing date for this. But to put it in here raises it beyond an intention in August that we're held to in January. It makes it a requirement. We can talk about intentions, we can talk about plans with just the same level of commitment to do it if it's not in the ordinance. Really, to me, it makes the ordinance almost meaningless in the sense of it says this is not the thing we really want to do. I don't know if this is the thing we really want to do because we don't have all the information yet. So the ordinance, I like. The sunset doesn't help the ordinance and doesn't help the process.
Other comments?
I have a comment.
Yes.
I would agree with Fran. And the reason I agree with Fran, I think we do have to have, good faith to say that we're going to complete the process. But as this pandemic has shown us, we can't control what happens. So if we put that date in the ordinance and we do not honor that and we push it back, then it's a trust issue. It becomes about faith. And so if we have it in the ordinance, but if we come back and talk about setting deadlines for us as a council, that these are times that we will do this, that will give us more leeway. But if you put it in there and we can't meet that deadline, then that won't bode well over for us as a council. So I think it's a very tough thing to actually put a deadline in the actual ordinance itself. But if we come back and make it intended, just as Bob is making some recommendations, there still may be some things we may need more time. And we're setting ourselves up. That would set us up for the possibility of, once again, not meeting that standard. So I would not necessarily put the ordinance, but that's something that I think we definitely, because it would be in the record, it would be in the minutes, to say this is the deadline or the timeline that we set for ourselves as a council. But if this has shown us anything, we don't know what that looks like. And then here we are in January, and we're trying to decide, do we need more time? And will we have to write another ordinance to address that? And this is taking us this long to get to this point.
And I'm gonna just, Mary, I'm gonna call on you to clearly articulate what our options are if there's a sunset to an ordinance, if it comes up January 18th, to everybody on council and the whole community.
If you look back at what y'all did in the moratorium ordinance, I think there was an option to continue the moratorium. I can't remember if it was for 30, 60, or 90 days, but there was a period of time. You can do it that way, or you can have an absolute sunset. Typically, you see sunset provisions in, not always, but often in legislative provisions regarding budgeting. So, like, the sunset drops and the money stops, whether it's I can't even give you an example, but I know that the United States Congress uses them quite frequently, particularly with respect to money like you're given to a particular cabinet department, or you're giving to the public in terms of funding. I don't know that either decision is wrong. Your sunset, putting a sunset provision, or we're putting deadlines in there, it does hold your feet to the fire. And that, every month, every week that goes by, you've had that many weeks since the beginning of the moratorium, recognizing the intervening pandemic that came along. On the other hand, leaving it open, it could send a message. I guess one message it could send is, my understanding of Strategic Ordinance 1 was that it was to be a temporary ordinance for the purpose of allowing council the time to make the decisions regarding the overlay districts and the standards to apply to those overlay districts in accordance with the white paper. If you leave it open, it can send a message that could be misinterpreted by the public as, okay, this is a permanent ordinance. And I've heard a lot of comments about the PD process, and I felt like people were thinking this is a permanent thing. But that's not my understanding of what it is, and maybe that needs to be made clear, that it's not a permanent process unless you come through your charrette process, and the recommendation is that you should adopt that process. But my understanding is for now that it's a temporary process. So temporary process, to me, it would seem appropriate to have some sort of end date. But that's just, there's several intervening things. You've got to rely on your development group, whichever one you choose, to be reliable to deliver their product in time. Then you have to have time to look at it and decide with zoning, any kind of zoning, you're going to have a public hearing to enact zoning changes. I do think that will be time consuming. 16 weeks from now, we're in the beginning of August, September, October, November. It's going to be the end of the year, and that will be difficult to determine what the proper date is if you're going to go through the entire zoning process or zoning amendment process. Todd might be able to speak to a timeline on that.
The timeline's going to be, if we get the report in mid-December and we send Todd to work as fast as he can on a package of ordinances that get at that, those then are going to come to us. They're going to have to go through Planning Commission. They're going to have to go through public hearings, and then they're going to have to go through 2 readings with us. Now we can get them into getting them into pending ordinance, but they're still going to have to go through Planning Commission to get there. And that's going to take a couple meetings. So I just don't think that the date, even in January, gives us nearly enough time, enough time to get to that. Given mid-December, we all know how Christmas goes. Is there some interim thing or some other way that we could put a clause, and before I would make a motion, third motion, that we could say that this will be reevaluated beginning in, in our second meeting in January, and every, X months, as we continue through the implementation of the redevelopment process and strategic plan. Because again, this ordinance gives everyone in commercial property a path forward, where had we left the moratorium in place, 2 acres or more would have been the only way that you could even consider it a PD at that point. So we've amended it so that we opened up a path for every commercial property owner that's affected to add residential. And guess what? Yes, PDs cost more, but they're on scale. You have a smaller property, your PD is going to cost you less than a larger property does, and going through that design. And at the end of the day, it also gives you way more flexibility, because the PD becomes its own zoning. You could build, Dr. Gosnell, you could build, if we let you in a PD, you could build 100-foot building on your property if you got that into an approvable, PD. And I know no one wants you to do that, and you probably don't want to do that. But the PD leaves it wide open to whatever gets approved. So the purpose of this is so we could do away with the moratorium and still give everyone a path forward while we continue this process in the best way and with the recommendations. Again, this was the recommendation in the plan about this area, was to do a redevelopment process, and that's where we are and what we're doing. So could we do something with like reevaluation in the?
We have a motion on the table.
We have 2 motions.
We have 2 motions.
Yes.
And his motion was merely to amend Mr. Duckworth's motion, the date of it. And then I think the discussion would be, are further amendments to the standing motion from Mr. Duckworth, is that appropriate? And then we bounce back to Mr. McGuire's.
Then get to the main motion.
Right.
One thing I was going to have, bear in mind, some of the people in the write-ups, we only talked to one, talked about 14 weeks. Well, if they started on this deal on August the 30th, okay, which we're going to meet on the 16th, so it gives them a couple ramp-up days. But we started on the 30th of August, 14 weeks, gets them to basically like December the 3rd. So, you could begin to, you've got a little bit more time in there, and I think that's something that we need to consider. The other thing that I just want to add, I'll go away on this, is the fact that we started out with a PD with 2 acres. Everybody in this room came in here about that, and we heard you and went to PDs with no acres. So we have listened, we have tried, we really have, but I do think we need to sunset this program.
Mary, to guide me in the right, Beverly, guide me in the right direction here, because I've never had where you have 2 different amendments. Next steps.
The intermediary motion would be Mr. Fulmer's motion. You can call a question if there's no further discussion, and take a vote on whether to adopt his amendment to Mr. Duckworth's motion.
I'll call a roll on that.
All right, so we have a call for vote, call for question for John's amended motion to go to January 18th as the sunset part of the strategic plan ordinance. Is that correct?
That's what I heard. Is that right, Mr. Fulmer?
Yeah.
All right. All in favor, raise your right hand. Any opposed? Okay, it does not pass.
So then you return to Mr. Duckworth's motion and see if there's further discussion on his motion to set the date for December 20th.
So let me address the motion.
Okay.
So I think there are 2 things that are necessary tonight. There's courage and there's trust. I think we have to have the courage to vote on something knowing it's not popular with everybody, that we worked on for a year and a half, probably the first big step we've taken to respond to the reason many of us were elected, and make sure that we follow that. But I think it also takes trust from you that we are going to do this in a timely manner with all the assumptions and beliefs that Bob mentioned, but trust us enough not to shackle us with a deadline. What happens if we don't meet that deadline is we take a huge step back and we lose the step forward we took tonight. that I trust, I'm not going to pick on Dr. Brookover, but Dr. Brookover has run this process so efficiently and effectively, I trust it's going to keep happening. The process we're talking about will welcome input from every person sitting in this room. You get to shape what happens when we come back with this. And again, not everyone's going to be pleased, but I want everyone to understand that we want you to have your input. So I don't support John's motion. I think we have to have the courage to take the first step for what we wanted to do for 2 years. I think we have to have trust, and honestly, I think we work for your trust. John, your point was great. We changed the 2-acre thing because people asked us to do that. So I think that's a good example of that. And even if you're unhappy with what the vote is tonight, either way it goes, get back involved in the process and trust it's going to work. So I'm going to speak against that, John, not because I don't think there should be a deadline, but I think we have to have the opportunity to flex a little bit within a deadline.
Moving to Mr. Brookover's question as to whether he wanted to make a motion to amend Mr.
Do we have
Douglas'
to
motion.
vote on John's first?
No, you can.
So, yeah, I would like to make a motion that we add language to the ordinance that requires us to reevaluate this ordinance by February 21st.
Second city council meeting in February.
Was that seconded?
I second it. Sorry.
Bob, tell me a little bit what you mean by reevaluate. Someone made a good point about maybe our plan's not clear. What is our plan in terms of reevaluating?
I want that to put some pressure. I think that's a reasonable amount of time, as long as we don't, as long as Ted, doom and gloom of COVID doesn't come true, and we don't have to we can't have public meetings and things like that. That if we get to the process between December 3rd and December 17th, depending on 14 or 16 week time frame, I think that gives us enough time to have responded, get an ordinance to Planning Commission, get it into pending ordinance form. That if we come to that point and the process may have blown up. The process, we might get to a place where we say, you know what, we can't find a path forward. And if that's the case, I think we need to be reevaluating and thinking about putting back in some by right for residential, because mixed use is not a bad thing, and that's what a PD, PDs allow for that. But I think that puts some pressure. If we reevaluate it, we come back and we say, here's the right thing to do by right. If this process gets to the point that if we can't, find as one of the consultants, and then the consultants did the plan the other day, said if there's not a there when we go through this process, that we can get to.
What does reevaluate mean? What if you get to that point and you're not ready to do anything? I mean, so you
Then that's part of it. I mean, it's not like it puts the pressure on us. It makes us get it back on the schedule to have that discussion, have people come and provide input, and make sure that it's on the agenda that night. Everybody in this room can come back, particularly property owners, if we haven't taken action, or there's not movement, or there's not a clear path forward, or what we've done. I want you back here on the 23rd and saying, you all said that you would reevaluate this, that it's you need to think about this ordinance, because now this path that is a higher bar to get over, we'd like to have a discussion about how that might change.
Catherine,
The more you talk, the more I get confused.
That's the goal.
Thank you. Because I have issues with a lot of this. I don't appreciate greed in all of its forms that sits here week after week. I don't appreciate the fact that we point out that there is a need for different kinds of housing and that gets ignored. I have lots of issues with that. No one is losing property values. We are very fortunate to live in the community where we live. And so I take that very seriously. What I don't understand, and I understand John's point about the deadline, and I could get behind the deadline. I appreciate Fran's point. What I don't understand now is that the end of this is supposed to be an ordinance. And that's what we're getting out of the 14 weeks, is waiting on reevaluating an ordinance. That's where I'm a little confused. I thought we were getting a report that would then set up the overlay districts, that would lay out multiple options.
Yeah, land use regulations, ordinances, yeah.
Okay, and so then what you're asking for is until February that we would have that done.
Now, I'm not saying that it's done, I'm saying that this just puts a date, instead of just saying that this ordinance that we're voting on tonight goes away and it reverts back to
Right,
what it
that's a
has been
danger.
before.
Yeah.
I'm just saying that we put that in there as a date that we know that at that meeting, we will be having a discussion about where we are in the process, and there's a chance we come out of 16 weeks with a plan that no one is happy with, potentially, that can't go, where I personally am not going to be in favor of continuing with this version of this ordinance at that point. So this gives us a time where we guarantee it's back on our radar to have that discussion, but it also gives us enough time where we can react to the plan after the 16 weeks in a reasonable manner.
That was my question, because I was like tapping at first. I was trying to understand. But what you're saying is, it's similar to what we did the COVID, our emergency ordinance. We would come back and review to determine if we're going to make any changes. So maybe we can use language similar to that. It wouldn't be the 60 days or whatever that was. But maybe we can use the language I don't know what that language was, to make it make sense. That's what we would do in February, is to come back and review, reevaluate, whatever that looks like. But it doesn't make it go away. It's just us coming back to
Unless we decide it goes away.
Unless we decide it goes away. So the ordinance will still be in place.
So almost, John, you'll be next. I'm sorry. Real quickly, I was just going to say that, going to Mary's point, this is a temporary ordinance. This is what we initially intended for. So putting that date in place is the right thing to do, in my opinion. This is a temporary aspect. John, go ahead.
Two things. One, Catherine, I'm going to call you out a little bit. I don't think it's fair to refer to people as being greedy. We don't know their circumstance. Some people have state retirement. Some people work and invest in the market. Some people use real estate as a means towards retirement. You could have family land. You could have lots of different things. I don't think that's
You're right.
fair.
I apologize, but it is a risk.
And
it is like
it's just
any
like saying
investment.
I'm greedy because I sell my house for twice what I paid for it.
But it's a risk.
That's a good thing.
It is a risk.
But as far as just putting the data in to evaluate, I guess to me that's style over substance. Because if you don't have a consequence at the end of it, I could ask Andy right now to put on the agenda that we review this on February 21st. I don't need that in the ordinance. That's any council member's right along the way, and I would do so. So that might make us feel a little bit better. That might sound good, but it accomplishes nothing. Because unless there's a consequence, unless there's something pushing you to meet that deadline, you've done nothing.
So I was ready to vote yes, but John just convinced me to vote no. I think, one of the, let's say we stay with reevaluate, which is very solemn, like the King Solomon approach. That night we could actually vote to continue the ordinance the way it is, because I frankly like the ordinance the way it is now. So it may very well be that, and that's why I like reevaluate better than end it, because reevaluate implies the notion of evaluation could be with this is the best we got and let's go on. I don't know that that needs to be in the ordinance. I think we could do that outside the ordinance. In fact, very next we can actually do that, but I can go either way. I think it's a nice approach. But I get to clarify to everybody the fairness that, to me, I like this ordinance the way it is, to be honest with you. So reevaluate doesn't mean it goes away. It may very well mean that it passes or fails because different people have different perspectives. And I might change mine over time. I don't know that. So I guess we vote on that.
I withdraw my motion and call the question on the original motion.
John's motion is still
on the table. The original,
which is December 20th.
John's motion is still on the floor, Mayor.
That's what I'm saying. I'm calling the question on that motion.
I'll second that.
All right. All in favor? John, would you like to repeat your motion again?
Well, the motion was that it sunset on December 20th, so therefore we would have to move to a pending ordinance status for the next thing. We would do our evaluation. We'd move forward where we are at that point. We would continue it if we don't have enough time. But that there is a deadline, there is a consequence to not meeting it. Or at least there is another vote at that point in time. That there's a forced vote on that date if you want to continue things as they are.
discussion on this? All in favor, raise your right hand. Any opposed? It passes, so. Then the original motion is considered a second reading of the strategic plan ordinance that was originally presented earlier this evening. Would you like to repeat that, Mary?
I'm sorry.
All right.
This is the original motion with the addition of the sunset provision as voiced by Mr. Duckworth just now.
Okay. The original motion with the sunset provision.
I think that was the only addition.
That's the only addition I have, is put that provision in there. Now, which I will still vote against this, I think we should have by right in it right now, but I'm glad we have the sunset provision.
You and I disagree on many things, but I agree that a deadline is not a bad thing.
All right. So we have that motion out there, the original motion. We already have a second. We already had further discussion. All in favor, raise your right hand. Well, no, actually,
time out.
That actually,
We don't, we haven't
yeah,
had a
we're done.
discussion on that.
Yeah, any further discussion, sorry.
So let's make sure, so we just passed where we passed the ordinance with the PD, and it's got a sunset of December 20.
What you did was you added the sunset provision.
You added the sunset to
Now
the
you're gonna
original
vote on
strategic
the
plan.
overall
Now you have to vote on the overall.
You have to
Now we're on the overall.
overall ordinance,
You voted on my amendment to put a deadline.
sunset.
Okay.
So now that is part of the motion. So
Okay.
now it's the ordinance that we've looked at for weeks ad nauseum,
Right.
but it has a deadline.
Okay.
Okay. So going back to the original ordinance, strategic plan ordinance number 1. All in favor, raise your right hand. Any opposed? Okay, passes, and we'll move on to the next item. Thank you for, Mary, thank you for the guidance, and, yeah, all these, I appreciate that very much. Next, we're going to consider a second reading of ordinance to approve state-issued certificate of franchise authority that has been filed by WC Fiber LLC. Andy, you're going to. Nothing's been changed. Andy, replayed
We
any.
can, why don't we, wait a minute?
Okay. Somebody like to make a motion?
I'd like to move that we consider, whereas reading the second ordinance to approve state-issued certificate of franchise authority that has been filed by WC Fiber LLC as presented.
I'll second it.
All right, we have a second. Any further discussion? All in favor, raise your right hand. Any opposed? All right, passes. Other policy items, consider authorizing the nonprofit NAMI to display messages on the city electronic message board. This was presented to me a few weeks ago. If you're not sure what NAMI is, National Alliance of Mental Illness, obviously, well, I shouldn't say, in September is mental illness, yes, sorry, is a month, and we will be reading a proclamation in September on this, but they have requested to be able to put information on our digital sign out on 123. And just as a reminder for everybody on City Council, which you probably already know, but I just want to remind you, anytime we have a nonprofit request, it has to come to City Council to approve that we are allowing this to be displayed. So, would somebody like to make a motion?
Make a motion, we authorize the National Alliance on Mental Illness to display a message on the city's electronic message board following standard approval process.
Second.
Second? Okay. Any further discussion? All in favor, raise your right hand. Any opposed? All right, passes. Consider adopting the revised Clemson Next white paper strategies are recommended by the Clemson Next Land Use and Development, Business and Economic Development, and Clemson University Relations Work Groups presented by Shannon Quattlebaugh. Thank you, Shannon, for sticking around.
I didn't even see her back there at the back.
So tonight I'm here to present the last 3 work groups' work for you, basically their recommendations from the Business and Economic Work Group, the Land Use and Development Work Group, and the University Relationships Work Group. So I presented those to y'all at the last meeting. Tonight is just for y'all to decide if you'd like to adopt them or if you have any other questions or discussion.
Shepherd is moving things along.
Any further discussion? Would somebody like to make a motion based on?
I'd like to make a motion that we consider adopting the revised Clemson Next white paper strategies recommended by the Clemson Next Land Use and Development, Business and Economic Development, Clemson University Relations Work Groups as presented.
You got to read it just a bit.
Second.
Second.
You did the second.
Frank can have it.
Fran, okay, over to Fran. All right, any further discussion? All in favor, raise your right hand. Any opposed? All right, it passes. Thank you, Shannon, that was quick. Mayor, council reports, comments, new business.
I would make a suggestion that, because I don't think we need to vote on this, but just that we put forth a statement as a city recommending the wearing of face masks in side public settings for vaccinated and unvaccinated. Not a mandate, just a recommendation that given the current surge, people be aware of the situation and act appropriately. Just an awareness that Dr. Swan gave us a lot of feedback on ways we could help. I'd also say we include things about vaccinations and opportunities and testing dental parts and everything else. It's a kind of public service statement. Whatever appropriate mechanism is, but just something to.
It just lists it out, it's basically
Yeah.
communication.
I mean,
You know, we highly recommend,
It was, oh yeah, go ahead, John.
we highly recommend the wearing of the mask, and then, you know, talk about Nettles Park, and then talk about vaccinations and those types of things, just kind of lay it out there.
Are we, if we're gonna do that, are we gonna commit to being an example and?
Well, I was just thinking, I mean, 3 y'all are tonight, probably, I mean.
Yeah, and going forward, we will be wearing masks in here when we meet with consulting firms on Wednesday. Okay. Yeah, that's what I'd say. If we're gonna do that, I would hope that we set the example ourselves.
But you're not gonna lock down the building.
No.
Okay, that's fine.
So let's clarify, and that's indoors, is that correct?
Indoors and in vehicles?
Well, DHEC's recommendation is universal indoor mask. It just says universal indoor masking. It doesn't clarify, I think, vehicles.
I think city vehicles would be up to Andy's administrative powers, but I definitely think that we're still subject to the national public transport because we receive federal funds. And so people on buses are still going to have to wear masks.
So CAP has to wear a mask,
Yeah.
right? You have to wear a mask on CAP because of the federal funding and
Federal
deal.
transportation, okay.
Okay.
So I would suggest not to do that. I would like to have an emergency meeting, maybe on Friday or Thursday, or meeting to talk about a mandatory mask requirement. So I'm not ready to settle for advisory. I just want to do this. DHEC says you should do it. I think we should say it's mandatory.
I want to add one thing, and when we're talking, I think you should take your mask off when you're talking.
So I disagree. We should only go part way. I think we should follow the DHEC recommendation, make mandatory. I think we should reinstitute the mandatory mask regulations.
So we have comments for recommendations. We have a comment for a special call meeting on Thursday or Friday. Do I have Fran, I think for a special call meeting, you need to, I would assume, make a motion to have a special sub. So if you call that, see if there's
Let me make the motion. We have a special call meeting on Thursday, either before or after. It's Thursday, right?
no, our other meetings are
It's
Wednesday.
Wednesday before or after that meeting.
At what time? Noon, okay.
Is that before?
That's before the 1
Fifth.
o'clock.
Oh, the 4th. We're talking about the 4th?
Yes.
I need a second. Okay, a second. Okay, further discussion there?
I won't be there, but I'm going to vote against it because I'm comfortable with just with the recommendation.
I mean, we're voting whether we're going to have a meeting.
Yeah,
That's
we're just
correct.
having a meeting.
All we're voting is on the meeting.
Yeah, I know.
Okay. Further discussion? All right. And the only thing I'll add, just because, I mean, I'm the same way. I mean, I read, here's CDC and DHEC's guidelines, mask recommendations at this time, and they are recommendations at this time. I would think that at this time, recommendations, I would not want to have a special meeting at this time. So that's just my thoughts. All in favor, raise your right hand. This is for the meeting.
All in favor of having a meeting?
Having a meeting on Wednesday at 12 o'clock
To talk about,
to talk about a mask mandate.
so you're saying you don't want the mask mandate?
No, you just say you.
You said you want to have a meeting about it.
You have a meeting about it. So, all in favor, raise your right hand, please. Okay, any opposed, raise your right hand. Okay, we're going to have a meeting this Wednesday at 12 o'clock.
Do we need to do any official thing about the resolution?
Yeah, I mean, you could take a vote. I think a voice vote on the resolution is fine as long as Andy's clear on what you want included in it. I was just gonna add, the numbers today were, I wrote it down.
2,300.
Yep, $23.99 today.
Yeah, I'm sorry. So yes,
I did, and Catherine.
Three.
no meeting. Sorry. No, I may have, sorry.
We
I
had over
apologize.
2,000
So,
cases.
so a resolution that strongly recommends following CDC and DHEC guidelines for universal masking indoors, regardless of vaccination status. What were the other things that we?
Is that what DHEC
We,
is
and
saying?
then were we going to say?
You can actually, like Dr. Swan said, to make sure the community is fully aware that we still have our community testing site at Nettles.
Community testing site at Nettles, you can be tested every single day from 7 to 11, Monday through Friday, and working on
And a
weekend
sniffle
times.
test.
I said, yeah, and then encouraging unvaccinated to get vaccinated. It has been well over a year since vaccines started going into people's arms, and there's no data with any significant side effects. What's it?
We do need to have, and Beverly, I asked you this question, but we need to do some updates to that vaccine page, whoever is responsible for it.
Is there a later guidance on CDC that you read than what I have in front of me? That was July.
It's changing every day.
That was July 27th.
They have not updated it, at least when I looked this morning.
Okay.
I did look at the DHEC had updated our county's transmission rate from moderate to high, and we're now over 200 per 100,000 in our county. And I was really surprised at this because I felt like Oconee County's vaccination rate was lower than ours, but we're now higher per 100,000 than Oconee County is. So that surprised me a little bit today. But they are also in the high range. Everybody in the upstate is now for transmission. So,
We're probably testing, I mean, part of the Clemson testing and community testing. We've got one test. We're do the old Trump explanation there.
I see what you're saying, yeah.
Because going in and testing this week because of potential exposure, and tested almost every single day since last, Tuesday. There's a lot of people going through the university testing, and when we've been out in the park, there's been people through there. So people are testing.
Well, unfortunately, this virus is supposedly, this variant is twice as transmissible, unfortunately.
I was surprised how many people were in there in Little John on Sunday morning at 10 o'clock as soon as it opened testing. Yeah.
Somebody asked me why all the cars were at Little John then, and I didn't know what was going on. I didn't realize it was a testing. Yeah, that makes sense.
The community centers?
Andy, do you feel good about, do you need this with CDC and DHEC? No, we got it. Okay, just making sure. All right, everybody comfortable with that? Do we need to?
So I heard the other day on the radio, the only group who approve of temporary recommended mask ordinances are the viruses. I think we've helped the virus out by not having mandatory masks. We really have. I'm very disappointed. We've helped the virus establish dangerous precedents in the city of Clemson because we didn't do that. I've never been disappointed in council until tonight. It's discouraging and disappointing.
Well, at the same time, by pulling down your mask right now, you're giving the virus a chance. I mean, just the yeah, so.
I think we fully discussed this. So, all right. Any other comments, new business?
Just for everybody, I went to the Municipal Association last week. That was a great conference. Hopefully you all can go next year. Catherine, you actually graduated from the Institute. They called your name out. So I was looking for you.
Eureka's been really nice.
But it was a great conference. Learned a lot of good information. So strongly encourage if you have chances to do some of the online courses, please do the advanced classes if you've already done some of the other institutional courses. Please feel free to do that. There'll be some announcements because I guess our next meeting will be in usually February.
in Greenville, not Greenville, Columbia, is usually where we meet, so that's just something, what I want to say. Thank you for letting me ride Andy, and I rode down together. We had to endure the storm, but had a pretty good time, so.
Well, we appreciate your attendance, Andy. Thank you very much for being there. I think graduates from the first year, I know, John, you've done both advanced. I think we had John, yourself. I graduated the first. You've done the first. You've done the first.
I think I've done the second too.
Well, you can't do the second.
I did half of the second.
How did you
I did
stuff
half of the
online
second.
Some of us had to go to
We'll
all
finish
of
the
them in
second.
person.
I gotta finish the second.
Exactly.
I did the
October
first
2nd.
half of the second.
Like Alicia was saying, please consider it is very good additional information from the municipal association. They're constantly giving online courses, and then there's a lot of value being there in person to learn best practices from what's going on. I know Andy and Lisa can relay that, so thank you very much for going. Any other comments?
I have just
Yes.
one, Andy, and this, just to keep it on the radar, and when we get an assistant administrator, I want to keep it on the radar to be thinking about the parks, recreation, tourism, arts and culture, organizational structure, what that looks like, opportunities that we have there, but keep it on the radar, but that might be a good assistant administrator task when we get them on board.
Any other, you want to relay that?
Just one announcement, 8 and under will be playing for the World Series Championship tomorrow.
Awesome.
And 12 and under will be playing for the World Series Championship.
Wow.
They're playing, both of them are playing a team from Florida, so they're playing Florida.
Okay.
Maybe they'll all come down.
Chief.
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 Chiefs.
Any other comments, new business? All right. Our next item would be to look at a legal briefing, South Carolina Code Section 3470A to receipt of legal advice related to ongoing litigation. Somebody like to make a motion to move to executive session?
So moved. Second.
Any further discussion? All in favor, raise your right hand. All right. Thank you very much. Thank you, Lowell.